सजना मैंने तुझसे प्यार किया मैंने तुझसे प्यार किया
A very pleasant good evening and welcome to the Ken Rampersaud Show on Island Zone Radio on this beautiful Monday evening.
मैंने तुझसे प्यार किया जीवन भर ये प्यार हमारा जीवन भर ये प्यार हमारा बन के रहेगा अपना सहारा टूट न पाए अब ये कसम टूट न पाए अब ये कसम प्यार न बदले अपना सजना सजना मैंने तुझसे प्यार किया मैंने तुझसे प्यार किया
A very good evening to Rhonda Spencer Tom.
जन्म जन्म साथ न छूटे अपना सजना सजना मैंने तुझसे प्यार किया 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 मैंने तुझसे प्यार किया
Welcome back to the Ken Rampersaud Show on Island Zone Radio on this beautiful Monday evening, the 12th of January 2026. So many things going on in the world right now as we're speaking, but we have to stay put, we have to stay focused and centered and grounded. First, I want to say my deepest sympathy to my neighbor, my front neighbor, who passed away this morning right here in Queens Village. Sean is a young man, 43 years old. He fell this morning and died. Was a good guy, but after the show, I want to pay a special tribute to him and to talk a little bit about him. And I'll do a separate live after this radio show today. So let's keep his family in prayers. his friends and family in prayers. I heard he was from Enterprise in Guyana. So um, today might be a little longer show than what I normally do, like just probably over an hour. But I'm going to try to keep it as short as I can, but that you will get all the information that you will need to know. Um, One of the reasons why I'm going to talk about cervical cancer, and I have to tell you that my show is not an entertainment show. My show, the Ken Rampersaud Show, is an educational show. um, and today I choose to talk about cervical cancer because this is a month has been put aside to talk about cervical cancer. And as we know that cervical cancer affect women all over this world, and it's important to have these information. And I've always believed that it's good to education is the key, knowledge is the key, and so, as long as we have knowledge, no one can fool us, and it's good for ourselves. Shaliza Ali, a very good evening to you in Ghana. Thank you for tuning in. Again, Rhonda, thank you very much for tuning in. And guys, you could keep it active in the shout box. I'm seeing I have two cameras running right now, so I could see what you guys when you guys tune in. And for those of you who I haven't seen, who I'm not seeing, thank you for tuning in and to watch the Ken Rampersaud Show on Island Zone Radio. So, as we know, that global cervical cancer statistic is kind of high, and incidence and mortality, which we get, was a 2022 data, and cervical cancer is the fourth leading most common cancer that affects women worldwide. So again, is the fourth most common cancer that affect women worldwide. Approximately 660 new cases were diagnosed globally in 2022, according to the World Health Organization, and approximately 350,000 women died from cervical cancer in 2022 alone. So that's a lot of people died. Around 1,800 women are diagnosed, and almost out of that 1,800, we have 1,000 deaths every day from cervical cancer globally. Roughly 90% of new cases and deaths occur in low and middle income countries. And we will find out in just a few minutes why the low income people are dying from cervical cancer, and access to HPV vaccination, screening, and treatment. And I will talk a little bit too about the HPV vaccine. Regional disparities. Many countries in the sub-Sahara Africa has the highest incidence and mortality rates, according to the World Health Organization. In 29 to 37 countries, cervical cancer is a leading cause of cancer death among women, especially in sub Sahara Africa and parts of Latin America. Almost all cervical cancer cases are caused by persistent infection with high risk of a type of the HPV virus. And as we know that the HPV virus is very contagious, and I will probably put aside to talk about the HPV virus next week on next week's show. um, and women living with HIV are 6 times more likely to get infected, right? Um, and to develop cervical cancer than women without HIV positive. So if you have and you are HIV positive, you are 6 times likely to get cervical cancer, and 13,000 new cases of invasive cervical cancer were expected last year in 2025. 4,320 women in the US were projected to die from cervical cancer. That was 2025, according to the American Cancer Association. And cervical cancer amount for about 0.7% for all new cases in women in the United States in 2025. And the trend over time, what they have seen in the US, cervical cancer incident and death rate dropped by more than half from the mid 1970s to the 2000s. And I will tell you why too. Due to this one, due to screening and prevention, although recent years have shown more stable rates, HPV vaccination has led to a drastic reduction in precancerous lesion and mortality, with some data show up to 60 to 62% of decline in deaths and serious precancerous among young vaccinated women. So I have to tell you that as we're talking about the vaccine, it is important to be vaccinated and encourage young girls and boys to get this vaccine, right? And we will talk more about it. Now, prevention and screening impact. Number one, the HPV vaccination can prevent a large majority of cervical case cancer because the vaccine targets the high risk HPV type that cause most cancer. Vaccination rate varies greatly worldwide. In some regions, only 15% of eligible girls are vaccinated, while others, while in other countries like Australia and New Zealand, where the coverage is higher, much higher. Screening. The HPV and POPs screening are essential to detect precancerous changes early and reduce cancer incidence and mortality. That's according to the World Health Organization. And as I said, you need to do your pap smear, woman, and I'll talk about this more. Pap smear is very important, and the vaccine. As we all know, that any form of cancer, early detection is the key, right? Recent um, research suggests that HPV screening is done every 5 years, and you should do it every 5 years to reduce cervical cancer death by up to 67% if high coverage is achieved. And one of the key takeaway is cervical cancer is largely preventable, absolutely, and highly treatable when detected early. Yet it continues to cause significant global mortality, especially for poor countries and where people are not working a lot of money. And this is information according to the World Health Organization. HPV vaccination and regular screening are the most effective strategy to reduce new cases and death, as per the World Health Organization. Despite progress, disparities persist with higher burdens seen in poor regions among underserved population. So here we see that poor countries is affected by cervical cancer. Hey, Stanley Ramsarana, a very good evening to you, and thanks for tuning in. Thanks for watching the show, my brother. I know my show is not very entertaining, and I encourage you guys to just watch for information. Like I said, is never too much, right? And as we said, this month actually is cervical cancer awareness month, so that's why I'm bringing up this topic, and that's how I plan to do my shows. Every month it signifies something, like for example, we also have diabetes during the month of January. So probably in the third week and the fourth week I'll be talking much more about diabetes. And diabetes can relate to stroke and all this, so it's very important. And what is cervical cancer? As we know, cervical cancer develops in the cells of the cervix and is most often caused by the HPV virus. As we know, the human papillomavirus. It is one of the most preventable and treatable cancer when detected early, right? Um, from a nursing perspective, and when I say early, early, one of the things that I've learned, and I've talked to a lot of patients, is that when you and I'll talk about the sign probably when I go get there. One of the thing is when you get the human papilloma virus, the HPV virus, probably after you've get exposed 6 months after, you will begin to see warts on your vagina, or your penis, whatever it is, or if you do tests, you will find out that you have this HPV virus, right? Um, as a nurse, I've seen firsthand how early screening save lives. Many women feel well and have no symptoms at early stage, which is why routine pap smear and HPV testing are critical in any case. Many won't feel well and have no symptoms early. Like I said, you probably would have HPV virus and you would not even know that you have the HPV virus. You would not have no sign or no symptoms. And the truth of the matter is with the HPV virus is that sometimes you have it and you don't know, and because you don't have no sign or symptoms. It all depends on your body how it works. If you have a good immune system, chances are you will never show no sign or symptoms, and it would just disappear. All depends on what kind of the HPV virus you have. And hope next week I could break it down more about the HPV virus, since it can lead to cervical cancer, right? Um, And like I said, many women will not feel no sign and symptoms, and pap smear and HIV testing is critical. Prevention is powerful and knowledge is life. Like I've said in my initial opening remark. Regular HPV viral smear and HPV tests, HPV vaccination for girls and young boys before they become sexually active. And you can start to get it from age 11, between age 11, age 12. As I said, if you have your young boys and your young daughters, encourage them, take them, let them get this HPV the vaccine, right? And not because and why you want them to get it, because if they go with someone who they're having sex with and they get exposed to this virus, to the HPV virus, chances are they would not get a virus and it would not be leading to any kind of cancer. And not because you take your child to get the vaccine, that means they're getting the okay to have sex. No, it is not an encouragement for children to go and have sex. All it do is help prevent cancer. And you want to continue to prevent safe sex practice, early treatment, and abnormal results, right? Um, and we know that, in North America here, I don't know about Guyana a lot, but what I find with the HPV virus, not HPV virus, young children, a lot of young children back in the days, sometimes you wait until you get married and then you start having sex. Nowadays I see these high school children having sex, 10 years, 11 years old. So it's getting bad. So I want to encourage parents to please encourage your children, or you take them because they're minors, to get the HPV virus. It's free, right? Warning signs that you don't want to ignore if you're a woman: abnormal when you're getting your menstruation, any abnormal vaginal bleeding, pelvic pain, pain during intercourse. As we all know, sex is a great thing and it should not be painful. Also, if you're having any kind of vaginal discharge, if it's kind of smelly, I see I have Nadia Mulchin watching all of you in Barbados. She is a registered nurse, also a midwife in Barbados. I met Nadia we all went to nursing school in Guyana. Hey Nadia, how are you doing, my dear? If you want to, and I know that you work in maternal health in Barbados, and if you want to chime in, feel free to do so. My beautiful Aunt Dolores Sigo Bin is watching. Thank you very much for tuning in. She's occasionally in Ghana, should be back in the US shortly. My sister Anita Ish Dowlat Ram is watching. Thanks to all of you for tuning in. And like I said, that my show is not a show of entertainment, it's educational. All right. So if something doesn't feel right, listen to your body and seek early care, or care as early as possible. um, a call to action: encourage women to schedule screening, talk openly. Women, back in the days, we parents didn't talk much about sex, about um, the vagina and all these kind of thing with the young daughters or even to the young sons. Time now to start having conversation with your children. And I believe that the best people to talk to your children is you as the parents. As parents, you have a right and a responsibility to talk to your children because they learn from outsiders and strangers, and they will learn the wrong things. All right. Encourage women to schedule screenings. Talk openly to your daughters, your sisters, your friends, and to your mothers. Break the stigma around women's health. Support access to care, especially in underserved communities. Like I've said, cervical cancer is preventable. Early detection saves lives. Awareness, we need to create actions, right? And let's talk a little bit about. That's right, Rhonda. Tune in, chime in, let me hear what you're going to say. You have to talk to your children. You don't want strangers to talk to your children. You want to talk to them about sexual health, when to have sex, when not to have sex. And I see so many young people going out of hand now. You know what I'm saying? And here in the United States, even if they get any STDs, guess what? You as the parents wouldn't even know. These children are so smart enough now that they go to the STD clinic, they get treatment, and as parents, you don't know one thing what's going on, right? So let's talk a little bit about some risk factors of cervical cancer. Smoking tobacco. Smoking increases the risk of cervical cancer. When HPV virus infection happens in people who smoke, um, the infection tends to last longer and are less likely to go away. So we want to encourage people, young ladies, don't smoke, right? Um, or if you start smoking, you want to cut it down. HPV causes most cervical cancer. Increased number also, it is not a time, now is not a time to go and have sex all over the place and with different partners. You take your partner, or if you can wait until you get your husband and wife, or you go ahead then and have sex. The greater the number of sex partner you have, is the greater your partner number of sexual partner you have. I mean, sorry, the more partner you have, the more you're exposed to the HPV virus, which could lead um, to the HPV virus. Early sexual activities. If you start to have early sex, which means 10, 11, 12, 13 years, wow, you got a long stretch to have sex there. And then you can easily get the HPV virus, which will lead to cervical cancer. Other sexual transmitted infection, having other sexual transmitted infection, also the STIs, increase the risk of HPV, which can lead to cervical cancer. Other STIs that increase the risk include herpes, chlamydia, gonorrhea, syphilis, and HIV/AIDS. Last month I did a whole month actually with HIV/AIDS. Also, something that I'm working on is to build my immune system. Women, I encourage you to eat properly, build your immune system so it will be strong. Anything, any kind of sickness you get, your body will be able to fight it for you. You'll be also, you may be more likely to develop cervical cancer if your immune system is weakened by another health condition and you have HPV. Right? Exposure to miscarriages, prevention medicine. If your parents also, and Nadia may know, exposure to miscarriage prevention medicine, which is the DES, while you're pregnant, your risk for cervical cancer might be increased. And these are old medication that they used to use back in the 1950s. I don't know if they still use it at this time. It's it's likened to a type of cervical cancer, and called clear cell adenocarcinoma, right? um I don't know if you guys want to hear another song now, or you want to me to continue. Probably I play a nice song for you guys, and then you a song for all the ladies that's watching the show tonight. This song is for all of you. You're watching the Ken Rampersaud Show on Island Zone Radio.
Yeah,
She's royal.
no, I've never been someone shy until I seen your eyes. Still, I had to try. Yeah. Oh, yes. Let me get my words right and then approach you. Woman, I'll treat you like a man is supposed to. You'll never have to cry. No. I know everyone can relate to when they find a special someone. And she's royal, yeah, so royal. And I want her in my life. I never knew anyone so one of a kind. No, the way she moves to her own beat. She has the qualities of a queen. She's a queen. Ooh, ooh, what a natural beauty. No need no makeup to be a cutie. She's a queen. She's a queen. And when they ask what a good woman's made of, she's not afraid and ashamed of who she is. She's royal, yeah, so royal. And I need her in my life. I never knew anyone so one of a kind until the night that I seen your eyes. Oh, my queen, so supreme. I can see it in her eyes, the way she smiles. Hey, yes, I know the king and queen crown, same time. So I'd never leave your side. Just stick with me through the trial times. Oh, and she says she no mind. Alright, I know good man is hard to find. And she can't about that giant line. That's why she has no ties at this time. Yeah, I know many men are trying, but she needs to be more than wine and dine because she's royal, yeah, so royal, and I want her in my life. I never knew anyone so divine. Oh, the way she moves to her own beat. She has the qualities of a queen, so supreme. Ooh, ooh, what a natural beauty. No need no makeup to be a cutie. She's a queen, so supreme, yeah. And when they ask what a good woman's made of, she's not afraid and ashamed of who she is. She's royal, yeah, so royal. And I want her in my life. I never knew anyone so one of a kind. No, no, the way she moves to her own beat. She has the qualities of a queen, my Nubian queen.
That's right. That's right. The royal queen. Um, she's royal. She's by Travis Riley. So, welcome back to the Ken Rampersaud Show here on Island Zone Radio. Another thing that bothered me this week was where they kill a young boy for his sweater, and that's sad. Luckily, that it's sad that he passed away, but they caught two of the guys who stab him up and so on. So this is another topic I'll be talking about after this show tonight. So let's talk a little bit back about preventing cervical cancer. As we know, one of the things you need to do is ask your doctor about the HPV vaccine. That we've said that before. Receiving the vaccination will help prevent HPV infection, may reduce your risk of cervical cancer and other HPV related cancers. Ask your healthcare team if an HPV vaccine is right for you. So you have to let your doctor know that you need to take this, and let them discuss it with them if it's right for you. Have your routine pap smear, which can detect precancerous conditions of the cervix. This condition can be monitored or treated in order to prevent cervical cancer. Most medical organizations suggest beginning routine pap smear tests at age 21 and repeat them every few years. Um, Also, you want to practice safe sex. And I want to tell you that despite you practice safe sex, a lot of times you wear a condom with HPV virus. Sometimes some of them could be very contagious. So you could get it on your legs, wherever it is that infected touch you, you could get it. If you practice oral sex on the person, you can get it on your lips, your throat, um, all over. You could get it. Okay, so you have to. I still encourage you to practice safe sex because it could also prevent chlamydia, herpes, gonorrhea, and HIV/AIDS. Reduce the risk of cervical cancer by taking the measure to prevent sexually transmitted infection. This may include using a condom, and you know that they have condoms for women too. And every time you have sex, and limited the number of sexual partners you have, again, and don't smoke, right? If you smoke, talk to your healthcare professional about ways how you could stop. Also, I want to tell you, as we're talking about smoking, if you call your state, New York State here, they have free gum they could send you where you could try to stop smoking. And as we know that smoking cigarette too lead to s- to can lead to cancer too, right? Lung cancer too. Screening tests can detect cervical cancer and precancerous cell and may one day develop into cervical cancer. Most medical organizations suggest beginning screening for cervical cancer and precancerous changes at an early age of 21. The tests are usually repeated every few years, right? And again, during the pap smear, a member of your healthcare team scrape and brushes the cell from your cervix. And the cell are then examined in a lab to check to see the cell if it looks different. A pap smear test can detect cancer cell in the cervix. It also can detect cells that have changes and increase the risk of cervical cancer. There are sometimes called precancerous cells, the HPV DNA test. The HPV DNA test involves testing cells from the cervix for infection with any type of the HPV virus and are most likely to lead to cervical cancer, right? Discuss the importance your cervical cancer screening option with your healthcare team. And let's talk a little bit about your diagnosis. Um, if you may have had cervical cancer, testing is likely to start with a thorough examination of your cervix. A special magnifying instrument called a colposcope is used to check for signs of cancer. During the colposcope exam, a doctor remove a sample of cervical cells for lab testing. To get a sample, you may need a punch biopsy, which use a sharp tool to pinch off a small piece of your surgical tissue. Endocervical curettage. I see this, the curettage when I used to work in the operating room, which use a small spoon shaped instrument called a curette or a thin brush to scrape the tissue sample from the cervix, and that's sent to the lab. If the result of these tests are concerning, you might have more testing done. They might include electric wire loop, which use a thin, low voltage that electrified wire to take a small tissue sample. Generally, and this is done in the doctor's office, you receive medicine to numb the area if possible, to lessen any discomfort during the procedure. This test also may be it's surgical excision procedure, which also known as LEAP, a cone biopsy, also called colonization, is a procedure that allows your doctor to take a deeper layer of cervical cell for testing. So they will go deeper. A cone biopsy is often done in the hospital while you're sleeping. Okay. Now, staging. And when we talk about staging, we talk about when people get cancer, you have stage one, stage two, stage three, stage four. If you're diagnosed with cervical cancer, you might need other testing to find out of the extent of the cancer, also called stage. Your healthcare team use information from staging tests to plan your treatment, right? Tests used for surgical cancer staging include an imaging test. Imaging tests make they take pictures of the body. They can show the location and size of the cancer. Tests might also include X-ray, MRI, and as we all know that MRI is more detailed. CT scan and also the PET scan, right? And most patients, when they get cancer, when they have cancer, they do a PET scan. Visual examination of your bladder and rectum. Your doctor may use special scope to look for sign of cancer inside your bladder and your rectum, right? As we said, the stages of vaginal cancer ranges from 1 to 4. The lowest number, which means that's the less where the cancer only stage at one place, right? As the number get higher, it's worse advanced. Cancer may have grown into involve nearby organs and spread to different areas of of the cervical cancer. So I want to tell you that, let's say you have stage one, it may be localized, it may just be in your cervical. Now, if you have stage four cancer, it may be cervical cancer, it may spread to different parts of the body, lymph nodes, it may go to your brain, it may also spread to your uterus, any part in your reproductive organ. Okay, it can go to your kidney and so on. So stage when you hear stage four, stage more is bad news for anyone. Okay, treatment for cervical cancer depends on a lot of factors. Hi, Tara Singh. Good evening, my dear. How are you? Hope all is well with you. The new year is good. Jasmine Madre, good evening to you. Thanks for tuning in. So let's talk a little bit about the treatment for cervical cancer. Treatment for cervical cancer depends on several factors, such as staging of the cancer. There is a stage one, stage two, um, other health conditions you may have, and your preferences: surgery, radiation, chemotherapy, or a combination of these three may be included. And guys, please don't forget to share the show to your friends and family, especially to your women friends, right? Surgery, if you do surgery, small cervical cancer that haven't grown beyond the cervix, they're typically treated with surgery. The size of your cancer, its stages, and whether you would like to consider becoming pregnant in the future will determine which operation is best for you. So it all depends. If you're a young girl, I would suggest, and you can talk to your doctor, they may want to tell you, listen, don't cut out everything, leave it, leave certain parts and be pregnant. Other options to cut away the cancer, as you said, for small cervical cancer, it might be possible to just remove all the cancers with a cone biopsy. This procedure involves cutting away a cone-shaped piece of the cervical tissue and lead to rest of the cervical intact. So they could take a piece and leave the uterus and all these things intact, right? Intact. This option may make it possible for you to consider becoming pregnant in the future, as I have said. Surgery to remove the cervix, right, called trachelectomy. A small cervical cancer might be treated with a radial um, trachelectomy procedure. This procedure removes the cervix and some surrounding tissues. The uterus remain after this procedure is done, so it is possible for you to become pregnant if you choose. Surgery is, and if you're an older person, um, and you don't need to get children, the best thing might be to do. And I'm not telling you what to do. I'm just sharing my ideas with you. The best thing may do if you're 60, 70 years old, just remove the whole uterus and done. So you don't have to worry that this is going to come back there. All right. Um, surgery, most cervical cancer that have not spread beyond the cervix are treated with radial hysterectomy operation, and this involves removing the cervix, uterus, part of the vagina, and nearby lymph nodes. A hysterectomy can often cure the cancer and stop it from coming back, like I've said, but removing the uterus makes it impossible for one to become pregnant. A minimal invasive hysterectomy may be an option for very small cervical cancer that have not spread to any area of the body, known as microinvasive cancer. This procedure involves making several small cuts in your belly or your abdomen rather than a large cut somewhere else. People who have minimal invasive surgery tend to recover faster time in the hospital. But some research has found that minimal invasive hysterectomy may be less effective than traditional hysterectomy. If you are considering minimal invasive surgery, discuss the benefits and the risk of this approach with your surgeon. And they are going to tell you all of this. Also, radiation is another option. Radiation therapy may be used as a powerful energy beam to kill your cancer cells. The energy can come from X rays, protons, and other sources. Radiation therapy is often combined with chemotherapy as a primary treatment for cervical cancer that have grown beyond the cervix, like into the uterus or wherever it is. It can also be used after surgery if there is an increased risk that the cancer may return. Radiation therapy can be given externally, called external beam radiation therapy. A radiation beam is directed at the affected area of the body. Internally is called Brady therapy. A device filled with radioactive material is placed inside of your vagina, usually for a few minutes, both externally and internally. If you haven't started menopause, radiation therapy may cause menopause. Ask your healthcare team about ways to prevent your egg, preserve your egg before. So, in some cases, if you want to become pregnant and you want to get a surrogate mother, you can save your eggs and get somebody else to get your baby for you, like a surrogate mother, right? Which is a good thing. In America, anything is possible. Chemotherapy. Chemotherapy use strong medicine to kill the cancer cells. For cervical cancer, this that has spread beyond the cervix. Low dose of chemotherapy are often combined with radiation therapy. Um, Chemo, as we said in short, may enhance the effect of the radiation. Higher dose of chemotherapy might be recommended to help control symptoms of very advanced cancer. Chemotherapy may be used before surgery to reduce the size of the cancer. So, yes, they could use chemotherapy to reduce if you have a big cancer and it's going to cause problems, right? And as you know, I'm not scaring anyone. When you get chemotherapy, I've tell people that chemotherapy, it pull you through the mud. It causes a lot of problems. Some people lose their hair and all these things. Um, Also, we have target therapy. Um, Target therapy is use medicine that attacks specific chemicals in the cancer cells by blocking these chemicals. Target treatment may cause cancer cells to die. Target treatment is usually combined with chemotherapy. It might be an option for advanced cervical cancer. So if you have cervical cancer stage 4, target therapy may be a good option for you. But like I said, I am just doing this show for educational purposes. And what you could do, always talk to your doctor and your team. They will give you the best advice what to do or what not to do, right? Um, Also, let's see. Immunotherapy. Immunotherapy is a treatment which medicine that help your immune system kill cancer. Your immune system help fights off the disease by attacking germs and other cells that shouldn't be in your body. Cancer cells survive by hiding from the immune system. Immunotherapy helps this immune system cells find and kill the cancer cell. For cervical cancer, immunotherapy may be considered when the cancer is advanced, when and other treatment aren't available. And palliative care. Um, Palliative care, um, I have to tell you, when you go to palliative care, is a special type of health care setting that help you feel better. And in short, what they do, um, they help you with your pain. They let you be a little more comfortable. You go, it's like stage 4 of cancer. You go there and they help you with your pain and whatever it is to live a longer life and to help you live a pain-free life. All right. And so how do you cope? And I can tell you that hearing the term that you've had cancer, it's not an easy thing. Oh Lord, tell me. It's like a like something like a brick stone fall on you. And how do you cope with this? It's tough. With time, you'll be fine. They help you to cope with the uncertainty and distress of cancer diagnosis. Until then, you will find that it helps to learn enough about cervical cancer to make decision about your care. Write down your questions before you go to your doctor's appointment. Get your family, get your friends to come with you to the appointment, to help take notes, to ask questions, to ask them questions that would help you for further um, source of information, to find someone to talk to, especially when you're the doctor. You may feel comfortable discussing your feelings with friends and family, or you may prefer meeting with a formal support group of families of cancer survivors also are available. So a good thing to do is find people who have had cervical cancer so you could talk to them. They'll be able to educate you and tell you where you can get your best treatment or whatever it is. And cancer treatment can be very tiresome. Some people get treatment, they go home, they sleep, they're tired. You know what I mean? Um, so it's good to take someone with you. Let people help if they want to help. Don't shun people away from you. As we all know that sometimes in life that we all get a certain sickness, but find the right person where you could sit down and talk to about your cancer and let people help you. Cancer treatment can be tiring. Let friends and family know what type of help you would need, and let them help you. Um, as I said, what type of help you let them know. If you need them to go grocery, let them know. Set reasonable goals. Having a goal help you feel in control and can give you a sense of purpose. But choose a goal that could be reachable, not to cause you to be worked up and be disappointed. Set goals that you can reach and your family could reach. Take time for yourself. Love yourself. Eat well. Find time to relax and not to stress. And get enough sleep and rest. Practice some meditation. Read a book. You know, play some games. Go out in the in a garden or something. Do some gardening. Can help you combat stress fatigue of cancer. So I wish you guys all the very best, and I hope that with all this information you get within 1 hour, that it could help you or help someone. Um, if you if you get diagnosed with cervical cancer, and I'm reading. So, Hafiz, a good night to you, and I'm reading Mark Ramsaroop. Um, his comment. Because I'm on the radio, I can't. I don't want anybody to sue me. But I'm going to read what Mark Ramsrew said. My uncle had luck with using soursop leaf and make tea and taking it daily. Mark, I would love to hear what your uncle's story. Let me know what kind of cancer he has. You can always inbox me and let me know. I could probably interview on the radio. I always like to hear people's story and what has helped for them. And I did hear soursop and soursop leaf tea is good. Turmeric help with radiation exposure. So I would love to sit down with your uncle and have a conversation. All right. So I have to tell you, this is the end of the show today. This is the end of cervical cancer. And what I want to tell you, early detection is the key. You want to make sure you go to your doctor, follow up with your doctor appointment. You want to do your pap smear tests. If you have young children, I want you as parents, you encourage your children, take them, talk to your doctor, let them get the vaccine, um, let them help you. Um, and I want to tell you about the vaccine. Let me see where I could pull it up. You want to get this vaccine so that you don't have to worry that your children would get anything like any sickness. All right. So, I was looking at to see about what is good for, and bear with me. I had the information somewhere um, about the tests, what you could do. So like I said, encourage your children to get the vaccine. That's the best thing that you can do for them. You know, um, especially children. And if you're having sex, practice safe sex. The best way to go. All right. So next week, if I think I've covered a lot of things about I've talked a lot about the vaccine. So I don't think I may need to tell you anything more about the, the cancer and HPV virus. But you want to make sure that you want to make sure that you follow your doctor order. And like I said, wear your condom, practice safe sex. Okay. On that note, ladies and gentlemen, I want you guys to have a very pleasant evening. And I'll be right back on this. Within 2 minutes, 3 minutes, I'll be back on to do a live. I want to share this. I wanted to talk a little bit about my neighbor who passed away. And also, I'm going to do another live. I want to talk a little bit about young people, how they stabbed that young boy um, and kill him. Okay? So let's tune in back in just about 2 minutes. Have a great night, everyone. Thanks, Anita H. Dowlett Ram. Thank you, everyone, for tuning in. If I haven't called your name, is that I didn't see it on the live. Have a great night, everyone, and a good week. Good night.